Hi, I'm Alex. I work for the King's Fund, a charity that's working to improve health and care. We work in partnership with the National Lottery Community Fund. We're working with 5 areas to get the NHS, local authorities and the voluntary sector all really working together to improve health. Lottery brings their expertise in funding, we bring our expertise in how the health system works, and together we have more impact than if we acted on our own. So the first thing I'd like to ask the Lottery to think about in its strategy is, are there more opportunities to work in partnerships like this with other organisations alongside the grant funding expertise that you bring? Because sometimes that can be really powerful than when we just try to do everything all on our own. The second thing is, NHS has just restructured and it knows that it needs to work more closely with communities and do so through voluntary organisations. This is a cultural change, it won't happen overnight, and we know that realistically it takes time for the voluntary sector to really have influence in the NHS. So I'd like to ask the Lottery to think, what should the balance be between one-off grant funding and sustained programmes of funding over several years? It's probably just a judgment call, but it needs thinking through, because sometimes those longer-term grants have more opportunities for impact and give us greater understanding of how funding can really have the most benefit. Finally, I just think it's great that the Lottery is talking explicitly about health and health inequalities nowadays, ever since the pandemic. The Lottery's funded loads of really valuable work in the past around the determinants of health, but not really used that vocabulary. It's great to have that explicit focus, because improving health and wellbeing is ultimately what people are really trying to achieve in so many cases when they apply for a grant.
Join the conversation at puttingcommunitiesfirst.org.uk.